Welcome to the fourth section, specific verbal de-escalation dealing with violence person. I would like to invite you to this section. Communication as an effective tool for calming patients was approved also in one pharmacology study. Agitated patients were given doping medication, midazolam. Nevertheless, a part of study patients had to be excluded because the personnel was able to de-escalate the communication and the drug administration was not necessary. Communication is still the most important connecting link of the medical care. Healthcare facilities are not an exception in this regard. The technical development, for example, equipment, pharmaceuticals, of the contemporary medicine was very remarkable in the last year. It strongly influenced the relationship, communication between the healthcare professionals and the patient. The communication has ceased to be the focus of interest. The patients who were mostly concerned registered this change. The patient requires nowadays the best services, modern devices and modern equipment, and he wants to understand all. Only an informed patient who understands what happened with him is willing to have confidence in members of a healthcare staff. Such a patient feels safe, has no reason to try to get the power on his side, because the general nurse can, through her professional approach, feel him to be a partner. If the patient feels safe, he normally doesn't put an front upon the general nurse. He doesn't accuse her and assaulted her. The answer to the violent situation in extreme stress is complicated, but the necessity of fast decision and the necessity of an immediate reaction. It's well known that the communication should prevent the provocation and the verbal and non-verbal part must be in balance. Nevertheless, in a stress situation, the communication form changes. The non-verbal part forms 50% of communication content, 40% tone of voice, and only 10% the verbal part. Said words are not so important. The most important is the behavior of medical staff members that can the violent situation de-escalate or in contrary escalate. Our recommendation includes also literature excerpts and proficiency practically prevents that can help to solve violent situations. We are aware that every violent situation is other and variable. Nevertheless, techniques were created that were proven as functional also in real situations. The non-verbal part has to be harmonized with the verbal part. The voice of our communication gets other voice color in stress situation and can sound completely differently. Men very often bark and bellow, women squeak. The voice helps us in a violent situation if it's calm, relaxed, but yet unfaltering. A right breathing is also an important part of the vocal expression we speak when breathing out. As long and deep breath is suitable for speaking. It is better to breathe through the nose in stress situation. It is possible to breathe out the stress literally. Controlling the situation can also help to stabilize the verbal expression when there are more people. In this case, the principle is important that only one person speaks with a violent patient. One health professional. More voices only increase situational stress. From the de-escalation point of view, it is suitable if the health professional introduces himself and asks, the patient how to address him. Following formulations are possible. Hello, I'm a nurse Anna. What is your name? How can I address you? I'm Anna, and you? Even though we know the patient's name from paramedics or he or her relatives, asking about his or her name is more personal and shows the interest. Also, the information about where the patient is and what follow is very important. Now, you are in hospital. We are going to do all to finish your examination as fast as possible. For your security feeling, I will take care of you so as nothing happens to you. The patient who is informed doesn't mostly complain and doesn't cause violence. It is better to speak with the patient in brief sentences. A sentence should not have more than 13 words. It is more suitable to use simple sentences, questions, and well-known words. For example, you are in hospital. For example, we can use this explanation for CT examination. I'm a nurse Anna. I will take care of you. At first, we do the CT examination. CT doesn't hurt. It is something like X-ray and take 5 minutes. Difficult words, questions or long instructions often confuse the patient and can increase his irritability, especially if he was waiting very long. Explaining each situation dealing with the patient health professional performs calms the patients and avoid useless misunderstanding. The patient has the right to get comprehensible, sufficient information. The health professional should not forget to let enough time for patient's answers, not to interrupt him for absurd information. The health professional repeats necessary and important information and checks if the patient understood him. Following questions are suitable. What do you want to ask about? Is there anything you don't understand? How did you understand it? What did I forget? Health professionals as well as patients are controlled by their negative emotions in violent situations. To be aware of his or her own wishes, what I want to achieve, and the possibility to ventilate his or her emotions has a de-escalating effect. To find out the goals of the patient, the health professional can ask. For example, I really have to know what you want to achieve now. You can really help me if you tell me why are you here. If I understand it well, you are angry because questions are regarding in verbal communication as very effective. A question is like stroking. If it is well chosen, it doesn't provoke and provides us with time for our next reaction. The health professional should speak with the crying patient on his tone level, loud, firm, and he should use the situation to asking question. The health professional shouldn't give instructions and advise him what to do. It is much more effective to describe patient's behavior, or the health professional can describe his or her feeling. I can see that you are angry. Who annoyed you? You are furious. What happened? It would be better if we sit down. When you are crying at me, I am afraid of you and cannot concentrate on your needs. The concept of patients involved by McKeown authors. The nurse. I don't think it is a good idea to hurt me. The patient answers patient. What do you mean? And the nurse reaction. Let us find it out. In order to understand what the patient is saying, the health professional should assume that the patient is telling the truth. Also, in the case that it won't be the truth, the health professional should try only pretend, he perceives it in this way. The interest for the patient decreases the tension at the violent situation and helps to de-escalate it. When we in addition confirm that the patient is right, you are right, for example, we acknowledge that we have never experienced what the patient is experiencing now. But we think that his feeling is right in us. When a patient, for example, claims, "You have a mess here, I have been waiting here for more than 2 hours," the health professional can answer, "Yes, you have been waiting already very long, you should be treated with more respect." The patient in stress struggles for power, he is helpless, and the form of his reaction, also defensive, can be an attack or an escape. The patient can also react in this way when he tries to achieve a certain goal: pain relief, immediate examination, disease symptom, long waiting. In such a situation, the offered alternative can be perceived as goodwill, offering water, magazine, go smoking to an appointed place, information about the examination, phone call possibility, offering another appointment date, and at the same time the distraction of attention, what is a part of the escalation, interruption of the decreasing tension at a violent situation. But we should not promise something to the patient what is not possible. For example, smoking in his room. Also, the communication technique called the absurd theater can serve as a distraction of attention. The principle of this technique are simple sentences that you are not related to the concrete situation at all. The technique is based on the theory of the absurd theater, when we surprise the patient with our absurd reaction. It means that things are said which are not connected to what was said before. The reaction surprises the aggressor and can also stop the violent reaction. When the patient asserts, "You have a mess here, I have been waiting here for more than 2 hours," the health professional can answer, "And with which car did you come?" The patient may answer, "With a car." What has it to do with it? The health professional may answer to it, "Nothing at all. I only deviated from the theme a little bit. So, now your requirement." It is an effective way to involve the patient into the communication by means of the word. We, in the case of a very angry patient, by using the words I don't know more how to explain it to you, or you don't understand it, do you? The health professional cannot involve the patient in the situation so that he perceives that he is a part of it. By using the word we, I don't know, where we are making a fault, that it is still not clear to us, we involve the patient into the situation. We show him that he is not a thing and that he participates in this situation and can affect it. A big problem in communication can come at intoxicated patients. In such a situation, it can help if the health professional imagines them to be his relatives. Then he or she will feel, for example, patients insults differently. Only so it is possible to get the concrete situation under control, because if the intoxicated patient finds out that he doesn't have an opponent, he doesn't attack anymore. On the other hand, it is important to inform the patient clearly about his acceptable behavior limits. The health professional should inform the patient that his even worse behavior reaction will be unacceptable. If it is necessary, the health professional tells the patient he may be arrested and prosecuted if he attacks him or her. The notice should be formulated as a matter of fact and not as a threat. For example, I don't want anybody to call the police. Possibly we can come along. When it is no more possibility to escalate the patient anymore by means of communication, the health professional can, in collaboration with other health staff members, offer pharmacological calming to the patient. In this case, it is necessary to persuade the patient that it is in his favor, his security, the security of other patients. The health professional can choose. I can see you aren't doing well. Aren't you feeling well? Can I offer you any medicine? We have to agree our next progress. For our better communication, it is better to take some medicine for you to feel well. Do you agree, please? It is also suitable to ask the patient if he has already got any calming drug in the past. If it is necessary to give drugs, the health professional informs the patient why gets them. Why ask you him or her? Even in this case, we should not forget to respectful communication and option possibilities. For example, from the view of your security, we give you now some drugs for your calming. Do you prefer intramuscular administration, intravenous administration, or would you like to take the drug as a tablet taken with water? If you are agree with the pill, we don't need an injection. We have here 3 sorts of pills. Which one do you want? In the case of a real threat, has the health professional always to take in account that he can be physically attacked. It is very often the violence arising from fear, and also in such a case can the health professional react verbally. Why do you want to hurt me? Do you feel secure? I won't neither violence nor injury. The founder of assertive communication, Arthur Smith, offers other alternatives reflecting the health professional's emotion. If you look at me like that, I'm afraid of you. I don't want somebody who would be hurt. We centrally can make us understood. I'm afraid of you. Please, I don't want to be afraid of you. It is always necessary to keep in mind that physical and pharmacological interferences into the behavior of a violent patient are not secure, and it is necessary to use them as a last possibility for solving such an extraordinary event. Neither kicking a door or breaking a chair means necessarily in need of restriction or pharmacological calming. In the case of possibility of calm de-escalation are exhausted and it is necessary to restrict the patient, it is always necessary to perform a written entry into the healthcare documentation. The entry should, besides usual information, contain also the opinion of the patient and perform restrictions. The modern clinical thinking supports less compulsory intervention and tries to bring the patient into the line as a partner, although he behaves violent. These attitudes can have many advantages in comparison with traditional restrictive attitudes. Patient restrictions are not the issue we focus on, because we support communication as a de-escalating technique, and the item of patient's restriction goes beyond the appointed range of our work and its goals. This action is possible only then if patient's violent behavior endangers himself or his environment. All available calming interventions are depleted and there is no physical present. As soon as a physician appears, it is his duty to access the whole situation for the using of restrictive intervention or their counseling, and to confirm the legitimacy of the situation and the medical documentation.